um, you get a much better picture of like what that vessel looks like, and I think his expertise would be pretty valuable as well. So I think with your blessing, I'd like to kind of set you up to see him after you get out of the hospital. We also have a nurse practitioner that can kind of help you with some of your kind of managing some of the medical issues as well, because making sure your blood pressure is in good shape over time, and being on cholesterol medication and the etc. Like all those things will help keep that that plaque to stabilize the plaque as well, and prevent strokes, because obviously there's some risk to whatever we do. We don't we don't have a crystal ball to say exactly what the right move is, but I think were that vessel to get smaller, or if you had new like events, or then I think it would be very clear cut that we needed to fix the thing. And I still wouldn't completely take like fixing it off the table at some point, but I don't think that we like necessarily have to do that now. I think it makes sense for you to probably follow up with Dr. Stemmer and
that's fine.
work through it with him. So I think that's pretty much like where we stand. We do have I don't want to make things too complicated for you if you don't live nearby, but in addition to seeing Dr. Stammer, we could also set you with our nurse practitioner that can kind of help manage the medical side of things a bit more if you're interested.
What does that mean?
Just kind of keeping an eye on your blood pressure and managing you're on aspirin. You'll be on aspirin Plavix for sort of 3 months.
She brought
stem therapy. And then kind of having a discussion as well with you as kind of going forward about different kind of like lifestyle considerations, stuff like that, if you're kind of interested in talking about kind of exercise, diet, etc. So
that's fine. Whatever
okay
would be helpful.
Okay, yeah, I think so. We'll set you up with like both folks. I think I'm gonna send a personal message over to Dr. Stemmer to see if we can get you in soon. So ideally within the next like kind of couple weeks, to kind of get his input.
Okay, well the plan right now for us is we're going to go back to Charlottesville.
Makes sense.
And we would be coming back here the end of March.
Yeah.
We'll be here for a couple of weeks.
He could potentially do like a video visit with you too, like a remote visit, if that's okay.
Yeah.
Yeah.
We can't do that test.
No, but you can at least have the conversation.
Right.
Right.
That's fine. Yeah, we were going to take all the tests and everything and maybe show it to some other
I think that's totally reasonable.
person.
Yeah.
But
I think
plan would be we go back there, come back here the end of March.
Yeah.
The end of February. No,
Yeah.
the end of March.
Yeah, and
then we're here for a couple of weeks. And then I'm thinking we go to Hong Kong.
Okay. Yeah, I mean, as I was saying earlier, I think I would probably kick it out.
We're postponing it.
Oh, you are? Okay.
That's
Good.
postponing
Okay.
it.
Okay.
he want to postpone it for 2 weeks, so it's like at the
Well, it would
mid-March,
then be
1.5 months.
yeah, a month and a half from now.
Yeah, I mean, I typically would recommend like waiting at least sort of 3 months or so, but it's your decision at the end of the day what you want to do. But okay, that makes sense. And then there's down in Charlottesville, there's some pretty good stroke docs out of like UVA as well if you want to talk to those guys. So
Sure.
and then just kind of make a decision going forward. The one thing I would sort of say is just that if you're going to treat it, generally want to do it like sort of sooner rather than later, within the first 3 months, preferably within the first kind of month, 6 weeks, something like that, after having an event, just to kind of get the most bang for your buck. But
Treat it meaning the surgery?
if that's where you end up doing a surgery, you kind of would want to do it sooner rather than later. So trying to get in, so it'd be important to try to see like one of the stroke doctors, or if you're going to get a second opinion, try to get in like relatively soon, within a few weeks if you can.
So you guys have looked
And I'd set you up with to see Dr. Stemmer.
But
I'll ask him a favor to see if we can get you in the next couple weeks or so with him. And we can do and he can do a virtual visit with you, at least to talk through it.
So you guys have examined all the tests again and again.
Mm-hmm.
And when you came to your conclusion yesterday,
Yeah.
that was after examining the last one particularly?
Yes. Yeah. Yeah. The last test, the ultrasound that they did in the neck, lines up pretty well with the ultrasound that, you know, in the vascular lab, lines up well with the one that radiology did as well. They look the same essentially.
But what
So
you
there's really
saw out of
no-
that was very good flow.
Yeah. Yeah.
And again, what did you say in terms of the angle of it looking narrower than it maybe was?
I think that like there's some discrepancy between the different tests based on like how we do the test, you know? So if you look at like the CAT scan, the CT angiogram, you tend to see, you know, a
More side view?
picture essentially, yeah, side view, and also kind of a side view, and you can look at it from different views, but you tend to see more the anatomy of the blood vessel. Whereas with the Doppler, it's more of a dynamic study. So they're measuring like the flow of the blood through that vessel. And right now, the blood vessel flow on the ultrasound essentially looks normal through the blood vessel, through that area of narrowing. Typically, what you would see if it was 70% plus is a pretty big elevation in the velocity of the blood flow through there. And I think it to me, it makes sense. You know, the two studies make sense. They're a little frustrating because they're kind of tell us different things, but they kind of make sense when you put them together in that like the blood vessels kind of has this like oval shape, and so I think the blood vessel, you know, the way they measure the area of narrowing on the CAT scan is kind of measuring like the narrowest point, whereas the Doppler ultrasound is measuring like kind of the overall sort of blood flow through the blood vessel.
And ultimately, the amount of flow of blood is the most essential thing, period.
Yeah, I think that's fair to say. Yeah, I think with the one caveat that, you know, where we know that more narrowed blood vessels are more likely to cause strokes. You know, the caveat is that like the narrowing most people's strokes are caused by like a disruption in the surface of that kind of cholesterol plaque, and so they get like a clot that forms on it and then it breaks off and goes downstream. So, and that correlates with like the more narrow the vessel is, the more likely that is to happen, the more likely it is to kind of block off. So you know, so yes, so the how narrow it is important.
Strength of the flows.
Yeah.
And that would be the danger of the heart having to work harder.
Not so much the heart having to sort of work harder. I don't think that would be as much of a contribution. Is more that we know that vessels, when they're more kind of narrowed and their flows pour through them, that they're more likely to cause strokes. And we know from like multiple studies that were done in the 90s and then the kind of the sort of early 2000s, mostly the biggest ones in the 90s, show that, you know, doing a surgical treatment and opening that blood vessel up for patients who have a severely narrowed blood vessel is better than just standard medical therapy at that time.
Has the medical therapy changed?
To the degree that like the statin medications, the cholesterol medications are more widely used. So that has changed. That probably does make a difference in the outcome, but there is a big enough difference that between the medical treatment and the surgical treatment in those old studies that most stroke professionals think that if somebody has a severe narrowing, that surgery, you know, makes sense to do. That surgery would still provide a benefit, even with statin, you know, even in the era of statin therapy.
So your guy in Jamaica, he's
He's a good doc. You know, he'll provide you with a good second opinion.
he has not connected about any of this.
I haven't talked to him yet about it, no. But I'll let him know. But he, you know, the benefit that we have of involving him is that he, out of everybody here, has seen the most sort of cases that are similar to yours, right? Because he wears the same kind of hat as me doing this job, but he also is like a vascular interventionalist, so he does those angiogram studies, and he also puts, you know, stents in, you know, blood vessels and things like that too. So I think he's a good person probably to get your kind of a second opinion from. Really the ideal person. So
Sounds good.
And I know he'll be back. So and I'll shoot him a little message and I'll needle him a little bit to
visit
kind of
him
get
in
you in.
Jamaica, do you think?
You could. He probably wouldn't love it. Okay, but yeah, I would definitely encourage. I think a second opinion is totally reasonable. I think it's been a little bit of a challenging situation, you know, to kind of figure out what the right move is. But
Right.
so I think if you know, let us know what keep us posted too with what the other guys are saying as well. When you know, if you see somebody before you see Andy, for example. Okay.
Yeah, absolutely.
And we'll have to talk to his assistant. Depending on his availability, though, we may have to kind of give you a call like early next week and just kind of let you know when he's
That's
available,
fine.
because we may have to ask a little favor to get you in, you know.
That's fine.
Okay.
I appreciate it.
Okay. Yeah, no worries.
All right, sounds good. So you
Okay,
guys
so we're gonna get you out of here today.
release
Okay.
me so I can
Yeah.
get the hell out of here.
I would.
I don't have to do any more cognitive tests.
No more cognitive tests. The last thing I'll say is just make sure you take your all your medications that we give you. You know, I know it's like, I'm sure I got vibes that you're not a medication guy. I don't think we totally talked about it, but
I'm not.
I think at
Oh.
least you kind of, for now, you have to be anyway.
Yeah, I mean, I'm gonna do it for
Okay.
now.
Okay.
But at the point at which I start believing I want to get off it,
Yeah.
are you able to like cut it in half?
I think you should kind of just cross that bridge later on down the road. I would say for now, like at least for the next like 3 months, we're gonna, I want you to like stick really closely to the regimen. Okay.
Yes,
All right.
and
Is
then
there-
after that we will do an assessment and then see how.
Yeah, but do it and work with your doctors on it. Yeah.
But I'm just saying in general, is that the way it is done to make it safer for you?
Well, typically, like they'll drop the Plavix after 3 months.
Okay.
Otherwise, the medication regimen's much the same.
Plavix
So,
is the blood thinner.
there's two. I mean, aspirin and Plavix. So you would kind of drop Plavix and stay on the aspirin basically for lifelong. But that's that. Yeah, that's the way we kind of balance like the
Lifelong aspirin?
lifelong aspirin.
That's gotta not be good for your stomach.
Most people tolerate it okay. Yeah. You're not having problems, are you?
I'm not at the moment, but when I was younger, aspirin
It bothered your
bothered
stomach.
my stomach.
Okay. Well, if that becomes an issue, let us know.
Yeah, yeah.
But yeah, it would either be lifelong aspirin or Plavix. Typically
So
aspirin.
where do I get the
Well,
information? How will that be
prescriptions,
presented
or-
to me?
Okay.
Prescriptions.
Yeah, we'll give you your prescriptions. Since you're planning on getting a second opinion, we probably should see if we can get a discharge summary together, and also we can get that to you too. So okay, so discharge summary will summarize everything we did. Okay, well you should give that to you before you leave.
Great.
Okay.
Thank you.
Probably it's a disc with this imaging too. Okay, so we'll get that for you too.
What
Okay.
time do you think I'm going to be able to get out of here?
What do you think, Todd? Maybe 2, something like that.
Yeah, it's probably early afternoon.
Yeah.
Okay.
Yeah, because we gotta
So-
get the disc, we gotta get the discharge summary done, those couple things, and
Okay.
then the nurses will have to give you their blessing. Do we have a pharmacy for you in terms of where to send everything?
Hillendale, CVS,
Okay.
Hillendale, VA.
huh?
See,
Virginia.
Maryland,
Okay.
CVS.
All right. Thanks, guys.
All right.
Thank
Sarah,
you.
Very
Thanks.
good. Thank you.
You're welcome.
I'll promise not to get another stroke. Okay.
Thank you.